like to introduce XI Hendry.
Good afternoon, my name's Kanika. I'm a physiotherapist from Perth in Western Australia, and today I'm going to be speaking about whether taping in ballet dancers changes landing biomechanics. This is from my honours research done in my final year of physiotherapy. Ballet is a popular pursuit amongst female adolescents. Within one class, dancers perform up to 200 jumps, all landing in turnout where the lower limb is externally rotated, starting at the hips. From early to late puberty, adolescent females have shown reduced control of movement, specifically at the hip and the knee, and this is thought to be a leading factor in the development of lower limb injury, and particularly anterior knee pain. A popular method in the management of anterior knee pain is taping. Brian Mulligan developed a taping method where he utilised immobilisation with movement to assist in the management of common knee injuries. Here, an internal rotation was applied to the tibia and an external rotation was applied to the femur and secured using rigid tape. To date, Mulligan's taping at the knee has not been investigated. Kinesiotape is widely used in the management of anterior knee pain also. It is a flexible tape, and one way in which we as physiotherapists tape the knee is by laying tape over the muscle vastus medialis obliquus, like so, and then we take it around the medial side of the knee, securing a medial glide to the patella coming up the lateral side of the knee. In the management of anterior knee pain, kinesiotape has been shown to facilitate vastus medialis obliquus with the improved onset of vastus medialis. To our knowledge, no studies have analysed the effectiveness of these taping techniques in ballet dancers, and specifically, nobody has explored their effects on joint range of motion, which in biomechanical words we call kinematics, and joint forces, which we call kinetics. Thus, the purpose of this study was to investigate the effect of kinesiotape, Mulligan's tape, and no tape on biomechanics of adolescent dancers when they execute landings from commonly practiced jumps. To determine this, 18, 12 to 15-year-old healthy dancers training at a competitive level consented to participate in the study. Participants were required to perform one bilateral landing in first position, or specifically this was a sauté, landing in first. And to ensure 3 viable trials, this was performed 5 times under the 3 different taping conditions: Mulligan's tape, kinesiotape, and no tape. And if you'd like to find out more about these conditions, I'm happy to have a chat with anyone after. To analyse kinematics and kinetics, we use the Vicon motion analysis system. This uses 14 cameras which pick up reflective markers placed on specific landmarks on the dancer. This then creates a 3-dimensional image of movement. Landings were performed on 2 force platforms, determining the forces going through the joints. This allowed us to analyse the peak hip and knee, anterior, posterior, medial and lateral shear forces, and the peak hip and knee flexion angles attained during landing. Statistical analysis used a series of ANOVAs to determine whether there was a significant difference in kinetics and kinematics between the 3 taped conditions. This graph represents the peak hip forces during landing. The x-axis displays the different hip forces and the y-axis shows the amount of force as measured in newtons. Here, a significant difference existed where Mulligan's tape resulted in lower peak posterior, medial and lateral forces at the hip when compared to no tape. We're just going to go back a moment. There we go. At the knee, the results followed a similar trend. Peak posterior and lateral forces were lower with the application of Mulligan's tape when compared to no tape. Kinematic data revealed there was no significant difference in hip and knee flexion in any of the 3 landing conditions. In any of the landings across all 3 taping conditions. On this graph, you can see the y-axis representing range of motion in degrees and the x-axis showing hip and knee flexion. It is clear that the differences in range of motion at each joint between the taping was minimal. Thus, our study has suggested that the application of Mulligan's taping reduces shear forces of both the hip and the knee during landings in first position without changing the range of motion attained in terms of depth of demi-plie. This suggests that with the application of Mulligan's tape, we have been able to maintain the aesthetic of the landing while reducing forces acting on the joints. Turnout is characteristic to landings in ballet. Often, adolescent ballet dancers utilise many different compensatory mechanisms to maintain this, and the problems associated with this are often exacerbated during lots of landing. This can lead to overuse injuries, which are also associated with an increase in joint reaction forces at the knee. Mulligan's taping may reduce these forces during the landings, thus offering a protective role for overuse injuries in ballet dancers. Compensatory turnout mechanisms, such as forcing rotation at the knee, not only affect the knee itself, but can also affect the more proximal hip joint and the lumbar spine. This is the first study to demonstrate the effect of knee taping on hip forces, despite the fact that it's widely suggested that knee injury may be associated with altered hip mechanics. Thus, our results suggest that Mulligan's taping may have a protective role at the hip as well as at the knee, particularly in relation to hip injuries associated with excessive force absorption. Future research should analyse these taping techniques within a population of people who currently have knee pain, or, based on our results, could also be done on people with hip pain. The study also looks at these taping techniques as applied to ballet-specific jumping techniques, and it would be interesting to follow through the investigation on other athletic populations or on other dancers, and looking at different dance movements such as those in contemporary dance. So, to answer the question that was posed on the very first slide, yes, taping does change the biomechanics with reference to peak joint forces of adolescent ballet dancers when they land jumps. This study is unique in the fact that it is the first to investigate the effectiveness of these two novel taping techniques, showing that Mulligan's taping not only reduces force at the taped knee joint, but also at the more proximal hip joint. Clinically, this research indicates that dancers can use taping to reduce joint reaction forces without a change in their landing technique. And I'd like to thank these people for their help throughout the research process and in preparation for this. Thank you.